Hey everyone, welcome back to the Founder Series, where we talk about the business of medicine, the biology of midlife, and how to build a life and body that carry you into your next decades with confidence. I'm Dr. Rebbecca Hertel. I'm a board-certified osteopathic family medicine physician, a certified menopause practitioner, and founder of Osteopathic Midlife Health, where we care for patients virtually across multiple states. All right, everybody, welcome back to the Founder Series, where we talk about the business of medicine, the biology of midlife, and how to build a life and body that carries you into your next decades with confidence. I'm Dr. Rebbecca Hertel. I'm an osteopathic physician, a certified menopause practitioner, and founder of Osteopathic Midlife Health, where we see patients virtually in several states: California, Florida, Illinois, Minnesota, New York, New Jersey, Ohio, Pennsylvania, Vermont. And today is a very special bonus episode. So I am joined by my daughter, who is currently a third-year medical student, and she's training at my alma mater, which still feels so surreal to even say out loud. But she's chosen to pursue becoming an osteopathic physician, and I wanted to record the conversations for a few reasons. It was a quick interview while she was with me at the Women in Medicine conference last September in Chicago. If you have not attended or gone there, it was incredible. It was like surrounded by incredible women, practitioners, clinicians, medical students. Dr. Shika Jane founded it and runs it, and she's just had the pleasure of meeting her, and she's just really incredible. And so we had some incredible speakers, some friends of mine that spoke, met new friends. So anyway, Lexi went with me, and we had a really, really incredible time. And so after this intro and history, it's going to go into that video recording. I want to make sure that I break down what osteopathic medicine actually is. She talks about why she chose that type of medicine and having an honest conversation about medical training and how it prepares you for and what it absolutely does not prepare you for. Because listen, this is about more than letters after your name, right? It's about values. It's about leadership and the future of medicine, quite honestly. So let's get into, first of all, what is an osteopathic physician? So I'm going to start with the basics because this gets misunderstood all the time. So an osteopathic physician, a DO, a doctor of osteopathic medicine, is a fully licensed physician. Same length of medical school, same residency training, same scope of practice, same board for certification pathways. The difference between our allopathic or MD colleagues is that osteopathic medicine is grounded in the idea that the body functions as an integrated unit. Structure and function are interrelated, and the body as an innate ability to heal when properly supported. That framework matters, especially in chronic disease, women's health, and prevention-focused care. So let me dive in a little bit to a brief history of the founder, Dr. Andrew Taylor Still. So osteopathic medicine was founded in the late 1800s by Andrew Taylor Still. Still was a physician who became deeply disillusioned with the medical practices of his time, many of which were ineffective and often harmful. He believed medicine needed to be grounded in anatomy and physiology, to respect the body's design, to treat the whole person and not isolated symptoms. So in 1892, he founded the first osteopathic medical school in Kirksville, Missouri. So what's interesting is that many of the ideas considered radical then, lifestyle medicine, prevention, whole person care, holistic care, are now considered best practice. So let's dive into DO education today. So today there are 30 accredited osteopathic medical schools in the United States with over 60 training campuses. DOs train in all of these specialties, right? All of them: primary care, medical subspecialties, surgical subspecialties, and under the unified accreditation system, DOs and MDs train side by side in the same residency programs. As a matter of fact, I did an osteopathic internship year, but I did an allopathic primary care residency. Allopathic, MD. Osteopathic, DO. Okay. So we also, as osteopathic medical students, and depending on the residency, it also could be your residency, we receive additional training in musculoskeletal medicine, osteopathic manipulative treatment, or OMT, hands-on diagnosis and treatment, system-based whole person care. So for many of us, that lens becomes foundational to how we practice. And in my primary care, yes, I do osteopathic manipulation. As a matter of fact, when I was in residency, my fellow resident colleagues and I started an osteopathic clinic or an OMT clinic while we were in residency. And so that was really, really a lot of fun. I should actually see if it's still going on today. I'm not sure if it is. But so in the segment coming up, we'll talk to, I talked to Lexi about, why medicine, why osteopathic medicine specifically, and what drew her to this path, knowing what she knows now as a third-year medical student. Because, this generation of medical students is entering medicine during a time of widespread burnout, system strain, massive cultural change in health care. We also will talk about what medical training doesn't teach. And this is where I want to pause because this matters. So medical school does teach us things like how to diagnose, how to treat, how to survive exams, rotations, residency. But what it does not teach us is how to become founders, how to be businesswomen, how to negotiate contracts, how to understand compensation models, how to invest, how to protect our time, energy, and intellectual property. Physicians are trained to be employees, not owners. Technicians, not architects. Workers inside a system, but not builders of systems. And for women especially, this gap is costly. If you don't understand the business of medicine, the business will run you. And this isn't about greed. It's about autonomy, sustainability, and impact. Being a founder doesn't mean you have to open a practice, but it can if you want it. A founder mindset means thinking strategically, understanding leverage, valuing your expertise, and designing a career aligned with your values. Medicine desperately needs, it needs clinicians who understand systems, who know their worth, physicians who can innovate responsibly. And this is the future of medicine, and we are not preparing doctors for it. So we also talk about in the next segment her advice for students considering medical school and those in their first and second years. What should they really know before applying? What she wished people had told her. And so before we go on to the segment, I'm incredibly proud of her, and not just for choosing medicine at all, because honestly, I'm proud of all of my children. I'm very, very lucky that, they're healthy. They are achieving their goals, but that she chose it thoughtfully. And because osteopathic medicine is rooted in principles that matter now more than ever. And the future of medicine depends on clinicians who are not just skilled, but who are empowered. So if you are a student, a parent, or a physician questioning what's next, this conversation is for you. So thanks for being here, and welcome to the future of medicine. Hi, everyone. I'm Dr. Rebbecca Hertel, and today I have an amazing, super special guest. This is Lexi Seifert. She is my oldest daughter, and she happens to be a third-year medical student. So today we figured that we would talk a little bit about a couple of reasons why she went into this and some pointers that she wants to give other future students as far as like going into medical school, why she chose it, maybe what types of advice she would give to future med students in going into their first or second year. And then now that she's starting her third year rotations, if there's any advice out to third year students also, because this is a transition for sure from your first 2 years. So why did you end up going into medicine?
Yeah, so I think main reason why I went into medicine just because, as a lot of us do, we just love to help people. I think that's my main thing, and then also seeing like my mom and how she interacts with her patients just like inspired me to also go into medicine. Also, I guess because I'm an osteopath, or I'm going to be an osteopath. I think experiencing that with my mom, I was constantly being adjusted, especially as a runner and stuff. So that was also another reason why I wanted to go the osteopathic route. But yeah, main thing, I love to help people. And then medicine is just super interesting, fascinating.
So if you had one piece of advice that you would give students or upcoming medical students who want to go into medical school, what would it be?
I'd say biggest piece of advice, I would say find your people and find people that who truly want the best for you and who truly care about you. Because I think especially in medical school, it's hard because there's a lot of people who want to like bring you down or compete with you. And I think biggest thing, just find those people who you really resonate with and you can like study with and lean on, because it makes the process go a lot easier.
So you find that when you're in medical school, it's really important to find that like student community that you can resonate with, the people that you really are spending like 2 years with that are studying with you. And so you need to make sure that it is a group of people that support you, that lift you up. They're not competing with you so much that like it's is a toxic relationship instead of an uplifting relationship.
Yeah, for sure. But it's sometimes there's the drama. Some people, I don't know, honestly feel that being in medical school is kind of similar to being back in high school again. So it kind of brings you back a little bit. It can be pretty cliquey at times. I mean, people aren't always the most supportive. So yeah, I think finding people who truly do support you is really important, especially because we really are going through the trenches for the first 2 years studying nonstop, and having those people you can kind of study with and hang out with outside of school is definitely super important, and I think really got me through those first 2 years.
Do you feel like the first 2 years were the hardest 2 years of medical school?
Yeah, for sure. I think now being a third year medical student, I kind of can realize how hard the first 2 years were and how many hours you are in the classroom and studying and how little free time you really have. So yeah, definitely get through those first 2 years, especially the first year. I think first year is definitely hardest just because it's a transition from college to med school. And then second year, you're kind of a little bit more in a groove, but still definitely the hardest years.
And I would say I agree with that. And this is 20 years. I would say that I would agree with that even 20 years later, right? So for me, the hardest time in medical school were those first 2 years. So that does not sound like that has changed very much. So, but now that you're in third year and you are starting your rotations, what piece of advice would you give second year students that are coming up into their third year starting their rotations?
Think about that one for a minute. I would say just keep an open mind, and I would say be kind of forgiving with yourself, because I think as a third year medical student, at least personally, I'm constantly feeling like I don't know anything and that like, oh, I don't belong here, especially like I'm fresh out of school. I'm used to like studying for exams, not for seeing patients in the exam room. From first and second year, I think we are used to studying for an exam and looking for like those buzzwords and studying for multiple choice tests. And it's completely different in third year when you're in like real world, seeing real patients. And maybe all the answers aren't going to be right in front of me like they are in an exam. Like you have to ask those questions, and just being forgiving with yourself and really open minded. And I don't know, taking advice from anyone you can, just taking it all in, honestly.
Yeah, I would agree with that too. Third year was really a transition year for students because you're going from books and now you're in the trenches. And I think that, that imposter syndrome sets in. And you also have attendings and residents that probably forgot what it's like to be a third year student. And so they may be a little bit harsher with you. Do you think that maybe medical schools need to be better at preparing their second year students for their third year rotations?
Yeah, I think for sure they need to be better with that. At least I think, especially coming from my specific learning pathway, I was lecture based. We didn't really do any clinical cases per se. I think if there's another pathway with the problem based learning, they do a lot more clinical based like problem learning and stuff. So I think they would probably be a lot more prepared. But I think in lecture pathways, I think we could have done more like breakout sessions or stuff or things like that, just to better prepare you for like the questions that you have to ask the patients. Like they're not always going to give you the information. You have to ask. And yeah, I think yeah, exactly. Yeah, how to present a patient to your attendings and practicing with that, because we really didn't get a whole lot of that.
You're just kind of thrown in and expected to know exactly what you're doing, right? Which, is unfair. And we also don't want to turn students away from medicine. Like we're in this crisis where we have every year less and less enrollment into medicine. And so there is a decline in physicians, a decline in OBGYNs, really all around family medicine for sure. And so, we really want our medical schools to make sure that it is a place of encouragement, of support, so that way we can continue to build this community of physicians across the board for years to come, so that when I'm old and when you're old, we have really, really great physicians and practitioners that can take care of our future. So thanks so much, Lex. I appreciate it. Hopefully she's given you guys some tips for any of you future physicians out there, or any, clinicians, nurse practitioners, gays. All of our clinicians are important and we value all of our colleagues. All right, all. If this conversation resonated with you, take a moment to share it with someone who needs to hear it, whether it be a colleague, a student, a woman ready to think differently about her health and her future. If you're watching on YouTube, please make sure to follow, like, and subscribe. It's the easiest way to support this work. And helps this content reach more people, more women who need it. If you're listening on Apple Podcasts, please follow the show and leave a review. Those reviews matter more than you realize and help other listeners find the series. You can also follow me across platforms for more education on all the social, Instagram, Facebook, YouTube, LinkedIn, for more education, clinical insights, and founders content. For clinicians, you can earn CME if you listen to this on the Pinnacle app. And if you want to learn more about how we approach midlife care, hormone optimization, metabolic health, you can find me at Osteopathic Midlife Health. So as always, this series exists to help you think differently about your body, your career, and your future. Because the next decades of your life deserve intention, strength, and clarity. So thanks for being here, and I'll see you next time on the Founder Series.